Welcome to our GAC Loss Prohibition Compliance Attestation. My name is Juliana Salazar. I'm Senior Vice President, Employee Benefits Compliance Practice Leader for the Pacific Region. And I also have our guest speaker, Darcy Turner. She is our Compliance Paralegal for the Pacific Region. So with that said, let's get started in addressing the GAC Loss Attestation requirements that many of you will be required to comply with in the next few weeks. So our agenda for today is quite simple. There isn't much lot to be said about the GAC Loss Prohibition on Compliance Attestation. For those of you who are reporting for the second year in a row, there isn't much to change or discuss as changes. It is just a protocol and procedure you need to go through. And then Darcy will take us through the GCPA reporting requirements. So she is the wizard behind the madness of the GAC Loss Attestation. She'll walk us through step-by-step review on how to complete the attestation, and I'll discuss who is required to attest and what the changes are for the 2024 reporting requirements. So let's get started. Let's start with an overview. What is the attestation requirements and who needs to comply? So the GAC Loss Attestation requirement is not a relatively new mandate. We reported last year for 3 years in a row. This particular requirement applies to all medical plans, and it also extends to pharmacy plans and other plans that render healthcare coverage to their members. And what it does, it requires the plan sponsor or employer to disclose to the Centers of Medicare and Medicaid Services that their plans do not have any contractual provisions that prevent them from disclosing or looking into cost and quality of care information for any care rendered to the beneficiary or employees. It also does not include any restrictions on having the employer or plan sponsor be granted electronic access to de-identified claims information and encounter information for each participating employee and or dependent. And it also requires that contracts do not restrict the plan sponsor or employer, in this case, from sharing information that is de-identified with third parties. So the attestation is intended to reaffirm that you as a plan sponsor and employer of a group health plan are not contractually bound to not have access to either cost or quality of care information or to share that information with third parties. What year are we reporting for? We're reporting for the 2024 calendar year. The reporting deadline is December 31st, 2024. How is that attestation submitted? Well, the attestation is submitted to the Centers of Medicare and Medicaid Services through the HIOS website. That is the CMS website. And it is a relatively simple process. You will have to register, and Darcy will walk us through step by step on how the registration process and submission process is completed. Your next action item would be to determine if, in fact, you are required to attest on behalf of your group health plan or plans if you sponsor multiple plans, or if, in fact, if you're self-funded or level-funded, your TPA or pharmacy benefits manager, PBM, will be filing your attestation on your behalf. So if, in fact, you have been informed that your TPA or PBM or behavioral health services program or any other provider that you contract for services as it pertains to your medical plan will not be filing on your behalf, then you will be responsible for filing the attestation on your own directly with CMS. Now, as we look at other provisions, we will see that the entities that are required to attest will be all group health plans. So we're looking at those in the individual market. For those of you who are fully insured medical plans, we only report for medical plans, including pharmacy. Your fully insured group health carrier will most likely be the filer. They will be completing the attestation on your behalf. However, it is important to ask your insurance carrier if they will be attesting on your behalf or not, as there's some outlier insurance medical carriers who will not be filing the attestation on your behalf. If you're self-funded or level-funded, it is important for you to ask your TPA and your PBM if they will be filing on your behalf, understanding that self-funded plans include those plans that cover only preventive care services, referred to as MEC-only plans, minimum essential coverage plans. This reporting requirement will extend to church plans, grandfather plans, non-federal governmental plans, and these would be plans sponsored by cities, counties, special districts, tribal governmental plans, as well as ERISA subject plans. And this would be ERISA subject plans, such as those plans sponsored by tribes and their commercial enterprises, and other ERISA subject plans. Which plans are not subject to the attestation requirements? HRAs, health reimbursement arrangements, and individual coverage HRAs or ICRAs are exempt from reporting. And also those plans that are rendered under ACA and other regulatory guidance to be deemed to be accepted benefits. These include limited benefits such as hospital indemnity, fixed indemnity plans such as cancer insurance, hospital confinement, as well as dental, vision, long-term disability, long-term care, Medicare and Medicaid programs, as well as basic health plans. Now, as we look into who is required to do what, it is important to look at what is your status. Are you fully insured? Are you a fully insured medical plan, or are you self-funded or level funded? As I noted in a prior slide, if you sponsor a fully insured medical plan, your insurance carrier, medical insurance carrier, would most likely assume the reporting and attestation responsibilities on your behalf. However, if that insurance carrier has informed you that they will not be filing on your behalf, you will be responsible for attesting directly about the status of your plan with the Centers of Medicare and Medicaid Services. If the insurance carrier has certified or notified you that they will be completing the attestation on your behalf, no action is required of your part unless the insurance carrier has asked you to complete a questionnaire. If they have asked you to complete a questionnaire, please complete the questionnaire by the deadline the carrier has noted. Now, if you sponsor a self-funded medical or level-funded plan, you would be required to ask the vendor if they will be filing on your behalf or not. If in fact the carrier has sent you a questionnaire, maybe your TPA or your PBM have sent you a questionnaire, please complete the questionnaire by the deadline noted on their email. If you fail to complete the questionnaire, most of these third-party vendors, be your TPA or PBM or behavioral health benefits vendor, will most likely not submit the gag clause attestation on your behalf. So it is critical for you to monitor those deadlines and complete the questionnaires on a timely basis. If you fail to complete the questionnaire on a timely basis and the vendor has indicated that failure to submit the questionnaire would mean that they will no longer file the gag clause attestation on your behalf, you will be responsible for filing that gag clause attestation. So your next items are, if you are self-funded or level funded and your TPA or PBM or other third-party vendor you use for your medical plan has informed you that they will not be filing on your behalf, you will be responsible for completing later than December 31st, 2024 for the 2024 calendar year. Now, as I noted earlier, who is required to report? All ERISA plans are required to report, understanding that you will be reporting on your plan, and that means that if you have multiple ERISA plan numbers, for example, you may have one plan that you sponsor for your union plan, which is a plan that you sponsor for union employees, and then you also sponsor a plan for your non-union employees, and they have different ERISA plan numbers, you are filing for two separate plans. The attestation would capture the union first, the union plan, and then a separate plan for the non-union. If you share the same ERISA plan number for the union and non-union plans, you would only be completing one attestation. Understanding that you can submit the attestation for your union and non-union plans, assuming you're the plan sponsor, not the union trust. You can't submit that attestation as a multiple reporting entity. So you will have to upload an Excel spreadsheet into the CMS HIO's website. If in fact you only have one plan number, you would be filing for that single plan number, as noted earlier. Also, it is important that if you are a member of a multiple employer welfare arrangement, a MEWA, or if you're the MEWA sponsor, you're an association health plan, the MEWA will be responsible for reporting on behalf of all participating employers. So if you're a MEWA sponsor, you file an attestation on behalf of all participating employers, including all of their plan information in your submission. If, on the other hand, you are a participating employer in a MEWA, the MEWA should be completing the attestation on your behalf, so no action is required of your part. For non-ERISA plans, such as church plans or tribal governmental plans, or those plans sponsored by state and local governments, it is important to understand that you will also be responsible for attesting on behalf of your group health plan, unless you are part of a joint powers authority where the sponsor of the JPA will be filing on your behalf. So both ERISA and non-ERISA plans, regardless of size, will be responsible for complying with the attestation requirements. Who files will be determined by the way that your plan is funded. If it's fully insured, your carrier. If it's self-insured or level funded, it may be left to you, the plan sponsor, to file, or the vendor that you've retained may file on your behalf. Now that we've reviewed who is required to report and how to report, let's review multiple attestations. So, items to note. If you are working with multiple TPAs and your TPAs have indicated that they will be filing on your behalf, it is important to understand that the TPA will be reporting only for the period of time that the TPA acted as your third-party administrator, your ASO vendor. So they may potentially report only for January 1st, 2024 through June 30th, 2024, because you changed to TPA B on 7/1. So TPA B would be filing from 7/1/24 through December 31st, 2024. If one TPA shares with you that they will be filing on your behalf, and the other TPA states they will not be filing on your behalf, you only file for the period of time that the TPA that chose not to complete the attestation on your behalf. That is what the period of time that you would report. So if TPA files on your behalf from January 1st through June 30th, TPA B states we're not filing, then you would file only for July through December 31st. Multiple attestations can be filed for a single plan, as I indicated earlier, meaning a tax ID number. If different entities rendered services by the attestation, if different entities rendered services to you, the attestation can be filed by multiple entities. So, for example, you have a medical TPA, you have one plan number, Plan 501. Your medical TPA is ABC Company. The medical TPA will be filing for January 1st to December 31st, as an example, for the 2024 calendar year. That is your plan year. The PBM can be filing on your behalf as well. They'll be filing for the same period of time, and so on and so forth. You can have your behavioral health services provider, a network provider. If you do direct contracting, all of these vendors would be responsible for filing, understanding that it is optional for them to assume that responsibility. If they do not file on your behalf, you will be responsible for filing on your own. Now, important reminders as we have new terms to use when we complete our GAG attestation reporting requirements. We have two terms to remember as we are completing our attestation that Darcy will walk us through. So attestation year is the period for which the attesting entity is reporting for. We are going to use 2024 because we are reporting for 2024. We already reported for 21, 22, and 23 last year, no later than December 31st, 2023. This time around, we must report for 2024, no later than December 31st, 2024. That is the attestation period, is the period that you have attested for. If this is the first year your plan is attesting for, that would be deemed to be your reporting year. Your attestation period differs from the attestation year. Attestation period makes reference to the date range in which the attestation is going to cover or apply. It's counted from the last day of your last attestation that was submitted, and it ends on the date that a new attestation is filed. So how do we define this? So for example, I achieved my attestation, I completed my attestation requirements in 2023, last year. So this year, for 2024, I submit my attestation on December 15th of 2024. And last year, as I noted earlier, I attested on December 1st of 2023 for the years 21, 22, and 23. Those were my attestation years. My attestation period would be December 2nd, 2023, which is the day after I filed my attestation for the 21, 22, and 23 calendar years, through December 15th of 2024, which is the date that I submitted my attestation for the 2024 calendar year. Now, what happens if I fail to complete my attestations and I never attested for 21, 22, and 23 last year? I failed to submit my attestation. I just did not know about it, or I made a mistake. Well, if you have not filed an attestation for prior years and your plan was in effect for 21, 22, and 23, and they were required to attest, then you are going to report your attestation period as the later of December 27th, 2020, or the date the group health plan became a reporting entity. So if you failed to attest last year and you were a reporting entity, you would use December 27th, 2020. If this is the first time you attest, then you would state that you would become a reporting entity. I started a self-funded medical plan. It's the first time I need to report. I would report for, in theory, January 1st, 2024, and you're attesting through the end of 2024, December 31st, 2024. So hopefully that clarifies the difference between an attestation year, which is the year for which you attest, versus attestation period, which is a time frame counted from the day after your last attestation until the date that you attest for the current year. Now, a couple other items to note regarding the instructions and changes to the instructions as you proceed to go through your attestation requirements. First of all, some of the changes that CMS made to the reporting requirements are as follows. Submitter contact information. They expanded this to include plan types. So there's 3 categories of group health plans that would be subject to reattestation requirements. One is an ERISA group health plan or a sponsor of an ERISA plan. That includes one sponsored by a union, non-federal or governmental group health plans, and lastly, church plans. So you would just check the type of plan that you are testing for. The reporting entity is now referred to as the responsible entity. And in step 3, the responsible entity types were also expanded to clarify that an ERISA group health plan or the sponsor of that plan, which includes a plan sponsored or established by a union. It also clarified the different terms: third-party administrator, pharmacy benefits manager, behavioral health manager, and also third-party providers such as an agent, or if you have other third parties you've contracted with for services, that is what you would be identifying in that section of the attestation. Now, continuing with other items, additional changes is clarifying labels that were used in the web form on your HIOS website. So the types of providers include a medical network, a pharmacy benefits manager network, a behavioral health network, and other. You would enter other if you have a different arrangement with a third-party vendor, like disease management. If you've carved out disease management, then you would enter the name of the disease management vendor. Other changes, there are a box that was added to include other limitations, and they also modified their attestation language to remove any forward-looking agreement actions, and the definition section was included to the appendix, and also a change was made to the attestation language to accommodate the date range at issue and other information that is required through the submission process. So the changes are quite basic, nothing major or overwhelming to concepts to grasp. With that said, I'm going to hand it off to Darcy, who will walk us through the step-by-step process on how to complete your attestation with CMS via the HIOS website. Darcy?
Great, thank you, Liliana. So we're going to go ahead and take the very first steps of what you're going to need to do, and that will be going to the HIOS web form, which you can access on the CMS web page under the gag clause section, and we can also provide links to that at the end of this if needed. So once you get to the HIOS web form, you will actually need to enter your email address and obtain a code that will be specific for logging in. And if this has been, if this is the first time, or if this is a returning user, the same steps will have to take place, as the code is only good for 14 days. So once you put in your email and then you click on don't have a code or forgot yours, you'll receive an email within 10 minutes from the HIOS submissions website, email address, and you'll be provided a unique code. So once that is provided to you and you receive that in your email, then you'll be able to log in. So thank you. So the first step would be entering your email address. And then if you don't have a code or have to re-enter your code, click on the don't have code or forgot yours down highlighted in red on step 1. Returning users will receive, will have to enter the same email address that they used last year for reporting. And then new users will enter an email address that they're going to utilize for this year's attestation reporting, or going forward, they'll be utilizing that same email address if they have to report next year. So select access code, and then a display message will pop up advising an email was sent to the address that was used, and then the unique code is only valid for 14 days. Once you've logged into the web form, you will be taken to your GCPCA dashboard. This will show previously reported attestations. If you're a new user, the dashboard will be blank and you will not see any previously reported attestations. This is where you're going to submit new attestations for the reporting year. And then also it does provide the instructions, the user manual, and then also the gag clause prohibition compliance attestation Excel template. So for the Excel template, this is only going to be used if you are reporting on multiple entities, such as union and non-union and MEWAs. So we will go over that here in a moment. So once you click on the Start a New Submission, it'll take you to the next step, which will be enter the submitter's contact information and then also the attestation year. So when you're selecting on the attestation year, be sure that you choose correctly from the drop-down box, and it will display 2021 through 2023, and then it also has a selection for 2024. If you did not previously report an attestation for the 2021-2023 year, you may want to do that so that you can go ahead and select the 2024. For returning users that have selected the 2021-2023 attestation, and you did see that on your dashboard, you will go ahead and select the 2024 attestation year. And then you'll enter the submitter's first and last name, and then it will, this is all going to be on one page, so then you'll need to scroll down, and that will be on the next slide, please. And then you'll enter the submitter's name, on which, as I just showed you, the submitter's email address, phone number, and then the employer name. The email address will be used, it'll be automatically populated into the box and it cannot be edited, which is the email address used to log into the web form. And then also indicate that your what your employer type is, and then you'll want to select all that apply. So for a group health employer group with self-funded plans that are self-attesting, then you'll need to select whichever ones apply. So either ERISA, group health plan, church plan, non-federal governmental group health plan, and then you'll click save and continue, and then it'll automatically move you along to step 2. So step 2 will be enter the attestor's contact information. So if the attester may be the same person who is submitting this web form, however, if the submitter and attester are not the same person, you'll need to select the box which states submitter is either the same person, or if not, then you need to enter the attester's first name, position title, and email address. If they are not the same person, you'll need to be sure that the person who is submitting, or excuse me, who is the attester, is someone who has legal authority to attest on or behalf of the responsible entity. So this would be of a C-suite or directors of departments, benefits manager, etc. So they may be the same person, or if there needs to be somebody else attesting on behalf of the entity, they'll want to be sure that this information is filled out. So then it'll move you along to enter the responsible entity's detail. So if the employer sponsor is a single group health plan, basically what they'll need to do is they'll go ahead and select that whether or not you are submitting on behalf of one or more group health plans. So if you're a single group health plan, or if this is a non-ERISA plan, the employer will offer, the employer that offers the plan benefits, they'll select no. If the employer is reporting on more than one reporting entity, such as for a union, and then they have another section of employees who are under a non-union or under 2 ERISA plan numbers, that would be yes under this category. And then you'll move along to entering the Excel spreadsheet and filling that out and uploading it. So that is the only time that anyone would utilize the Excel spreadsheet, is if you are reporting on multiple entities. So if you're only reporting on one entity, and that is the employer themselves and no one else, then you will just select no, and then you'll move along. But if you select yes, then it'll populate the section with the upload of the Excel spreadsheet. So for the multiple entities Excel spreadsheet, it will populate into the next steps, and we'll just kind of briefly go over this. That the Excel spreadsheet, like I mentioned, should only be used if reporting entity is reporting on behalf of multiple entities, such as a MEWA reporting on for participants who are under multiple employers and have different EINs. Employer sponsors a union or a non-union plan with separate plan contracts based on the employee classifications will also utilize this. So there is a pop-up window, which you see on the left of the screen, that does give a little bit more detail as to the responsible entities in the Excel spreadsheet responsibility. On the next slide, it will take you into the responsible entities detail. So when you're selecting, if you are submitting on behalf of more than one group or health plan and you select no, you'll move along into the responsible entities detail. So you'll enter the name of the entity, the type of the responsible entity, which you see the pop-up window. You can select, there's a question mark next to where it says type of responsible entity if you are unsure about your entity, and it will bring you to the pop-up window that you see on the right of the screen, which outlines the different plans or the different entities, excuse me. So you have church plan, ERISA group health plan, non-federal governmental plan, and then health insurance insurer. So if you're an ERISA group health plan, you will select that drop down and then move along to the name of the responsible entity's point of contact, and then the employer identification number, ERISA plan number, and then mailing address for the responsible entity. Then you'll move along to entering further details of the responsible entities, as this is still on one web form page and it is a scroll down. So it will ask you if you are attesting for all provider agreements, yes or no. So use yes button if you are attesting for all the responsible entities provided within your agreements, medical, pharmacy, behavioral, and any other agreements with the healthcare providers. You would use no if you are attesting for only the subset of the provider agreements, or only attesting for the service agreements such as radiology, laboratory, network agreements, and also if there's any administrative service only agreements or third-party service agreements and claims repricing agreements. So if you select no, you'll utilize the drop-down options and you will select which ones that apply. So whether it's a medical network, pharmacy benefit manager network, behavioral health manager network, or other. If you do select other, you will be able to describe the other provider agreements and the types of which you are reporting on and attesting for. So that would be, like mentioned, the radiology or laboratory network agreements, any agreements that are not listed and that you are attesting on behalf of. So then the next section would be the attestation period. So the attestation period is the period of which you are attesting on behalf of. And then you'll be able to either manually enter the month, day, and year that you wish to start your attestation period, or you can select previous attestation and end date. So if you click on the previous attestation and end date, this would be for a returning user who wants to retrieve the dates that you attested for the last reporting. So once you click on the previous attestation end date, you'll automatically populate when the last submission date was. And then the end date would be the date which you are reporting for as of this year for 2024. So in the population field, you can see over on the right hand of the screen where it states last year's completion submission. Once you click on the blue button that states previous attestation end date, you will then select the previous year, which is going to be a pop-up, and then you'll use selected date. Once you select that, then it will automatically enter it for you. And then also you'll be able to utilize the date which you are submitting today, and that will end your attestation period from the last reporting date timeframe to the date which you are reporting in 2024. Reminder that the attestation period begins the day after the prior year's attestation was filed and is extended through the date which the attestation is submitted for the new reporting year, which would be the date which you are reporting the attestation and entering it into the web form. So the next step will be the attestation. Review your submission, attestation, and submitter and attester's contact information. So you will review the submitter's contact information, attester's contact information, and then the responsible entity's attestation detail. If everything is correct and you don't need to go back and edit, you may save and continue, and then you'll be completed with step 4 of your submission and attestation. You'll be taken to the next step. So the next step will be review and submit, and the attester will want to thoroughly read this information and then mark the boxes accordingly. So you'll want to make sure that you're checking the boxes that you are attesting on behalf of the group insurance, health plans, and then also provide the digital signature for submission. If you go ahead and hit submit, you will receive a submission successful box. And in this box is your only time that you'll be able to print the submission receipt indicating that your attestation has been submitted, and you can save the PDF or print it for your records. Once that is done, then you will return to your dashboard and close the box out, and then you'll move along to reviewing your attestation and their actual current status. The attestation submission status will show, and it'll indicate whether it is completed or if it's in progress. So you can check your status here if you're wanting to make sure that you completed your attestation and it's been submitted for whichever attestation year. So you can see this individual, Jane Doe, has reported for 2024 as well as for 2021 and 2023. So those have been submitted and they are completed. If you wish to save and return to your work later, it will state in progress, and you can pick up where you left off once you have saved it. And then if you close out, you want to make sure that you save your work before you close out. That way it saves it and it'll be in progress on your dashboard. Some resources that we have provided here and the help desk information, and this information is also located on the CMS website under their gag clause webpage. And if you do have any questions regarding submitting your gag clause, or you're having any kind of technical difficulties, you can contact the CMS help desk either by calling them or you can email them. If you do send an email in regards to the gag clause, you'll want to make sure that you do indicate that in the subject line GCPCA, and they will usually get back to you within 2 to 3 days, depending on the amount of emails that they're receiving, if they have a high volume or not. But here is some information that is very helpful: the instructions for submitting the gag clause, the user manual that has step-by-steps as well, and also the Excel spreadsheet template, the actual web form link to get to the attestation web form, and then also the FAQs. So this information is very helpful if you do need help with any other steps or contacting the help desk.
We want to thank you for joining us and hope you have clear guidelines on how to complete your gag clause attestation. If you have any questions, please feel free to reach out to your hub representative. This concludes today's webcast. Thank you.
Thank you.